Reporting is pillar number 1 in the 7 pillars and is absolutely essential for the 7 pillars to work effectively. Organizations, group practices cannot fix what they don't know about. But occurrence reporting can sometimes be a struggle in certain organizations, and so we need to think about what are the drivers of human behavior and how do we understand those drivers so that we can get more reports into the system. Those drivers of human behavior are fear, greed, and ego. And depending on who you are and where you exist in the organization, those drivers can be used in different ways. For the staff in the hospitals or in the outpatient clinics, we understand they may not report for a couple of reasons. One is the fear of retaliation, and the other is apathy. The concern that, why should I report? I never hear anything back. I have no idea if they're doing anything with that. And so to deal with the fears of retaliation, 1, we have a very clear policy that is completely unacceptable, but 2, we also gave them the opportunity to provide these occurrence reports anonymously, where they can be protected in that process of letting us know what's gone on and not worry about their name being given to somebody that they were the ones to let us know. The other thing we have done is to try to create a feedback loop where they do understand the data they provided us is very helpful and is helping us to change and get better. For the resident physicians and some of the others, we had to create incentives. And one of the incentives for the resident physicians is they need to be able to demonstrate their competencies in event reporting in order to move on to the next year of residency. We create the expectation that on clinical rotations, they have to report into the system an unsafe condition or a near miss or even a harm event so that they can become part of the quality and safety efforts in the organization. And finally, for the attending physicians, those processes didn't seem to be particularly useful, and so we had to figure out a way using the other drivers to get them to report. And so for the attending physicians, if the first time we hear about a significant patient harm event is through a claim or a lawsuit, then the group practice, the physician leaders have agreed that we can assess the clinical department in which those doctors reside a fine of up to $50,000 if, in fact, the first time we hear of a harm event is through a claim or a lawsuit and not from them letting us know what it is that happened so that we could, in fact, mitigate the financial damages associated with that harm.